We begin with a major development in the fight against COVID-19. The White House expected to announce this week that anyone who got the Pfizer or Moderna vaccine should get a booster shot 8 months after their second dose. The shots could start as early as mid-September if approved by the FDA.
Your third shot would likely be the same brand as the first two. Officials are still warning for more data before issuing guidance on the Johnson & Johnson vaccine. And today, Mayor de Blasio said the city is prepared to administer the third round of vaccines as soon as the FDA signs off. Healthcare workers and older Americans would likely be given the shots first, and some of those immunocompromised are already getting a booster shot. CBS 2's Carolyn Gusoff has more.
Number 3 in the books.
Number 3 in the books for 81-year-old Art McGee, fighting multiple cancers. He's among the first to get the added protection of a third dose of the COVID vaccine.
I had no side effects from the first 2 shots. They're working, and I'm hoping I'm around for next year.
Doctors at Northwell Cancer Institute called this the next big step in the pandemic. Those recently completed or undergoing cancer treatment are 500 times more likely to be hospitalized or die from COVID-19. The FDA recommends the booster for the immunocompromised as soon as 28 days after the last dose. Dr. David Cheng is fighting lung cancer.
I believe the vaccine is our really best tool to actually deal with this pandemic going on.
So that's a profound and deeply important message to get out to the public. It is so important to take care of our most vulnerable patients.
But we could soon see boosters for all vaccinated Americans. A formal announcement is expected this week, green-lighting booster shots 8 months after a second Moderna or Pfizer vaccination. No word yet on Johnson & Johnson. Dr. Max Gomez says the data shows a significant boost in immunity.
We know that the immunity that the Moderna and Pfizer shots confer tends to weaken with time, from the mid-90 percentile down to mid-80s or even lower. A booster shot brings added protection back to its original level.
If the demand is what they hope it will be, doctors predict a return of mass vaccination sites.
Supply is no longer a problem. We've developed an infrastructure here for setting up vaccine sites very quickly and very robustly.
The boosters are for now identical to the first shots, but that could change. More than 90% of new infections are among the unvaccinated, and doctors say that increases the risk of new variants and the need for new boosters. In New Hyde Park, Long Island, Carolyn Gusoff, CBS 2 News.
As of today, the booster shots are approved for those with immunodepressive disorders, organ transplants, and also on medications that weaken the immune system.